I kind of covered the brief overview of the apocalyptic 2020 that we currently live in, but you've got some more of that apocalyptic 2020 related to our veteran community or service members. What is going on at the VA, and when should I panic? When should I start storing food to get me through the death winter that is upon us?
Well, I wouldn't start panic buying just yet. Cases are increasing all across the United States. This is in no way unique necessarily to the VA and its massive healthcare system. So it's important to know that while cases are increasing at VA and have hit record levels now for about 2 weeks in a row, we're seeing roughly 11,000 active cases, which means people who are actively sick. And that is much, much higher than the previous peak, which we saw in July, which was around 6,400 cases. So we are close to doubling the previous peak, and we are right around tripling some of October's numbers for those active cases, which is very concerning. But the good news at VA, at least, is that their hospitalization rates. So you may have an increase in the number of people who are sick, but the number of people who actually need to be hospitalized is still fairly low. The percentage of those patients has been going down the longer the pandemic has been happening. So in March, the number of sick VA COVID patients who needed to be hospitalized was 38%, which is really high. Now it's been going down and down and down. So last month it was about 15%. Right now, so far in November, it's about 13%. And that is what VA is using to sort of gauge how well it's doing in the pandemic, is how many people have to be in a hospital.
So let me get this straight.
Yeah.
We have an increase in COVID numbers at the VA, but the number of those people that require hospitalization has dropped down dramatically.
Yes.
So dramatic increase, but dramatic decrease in hospitalizations. That hospitalizations part, and that's what the VA is saying, that's our measure for success. We keep those hospital numbers down. We are being successful. What does that mean, though? So we have less hospitalizations. Have we been able to pin down like why those hospitalizations, numbers going up, hospitalizations coming down? Why are those two numbers so closely aligned?
That is a great question. So not everybody who gets COVID gets really, really sick. There is a whole spectrum of symptoms and severity of this virus. And so some people who get it can recover perfectly well at home. It's not enjoyable, just like being home with the flu is not enjoyable, but there are lots of people who are able to recover at home and don't need medical assistance. And what has changed between March and now is we do have, in some ways, a better understanding, and by we, I mean the medical community and medical professionals, but they do have, in some ways, a better understanding of the virus and also how to treat the virus. And another really great thing is that because more people are tested, more people learn they have the virus earlier, and more people are educated about the symptoms and know, oh, maybe I should get tested. And so you're also catching cases earlier on when people are less sick and can be monitored, can, maybe call their doctor for a teledoc appointment, learn the things that they can do at home to take care of themselves, and they don't escalate to the point where they need to be hospitalized. So yes, we are seeing more cases that are asymptomatic, and more cases in which people are sick to varying degrees. But we overall are doing a better job of catching it early, of treating it, and we are seeing fewer people having to stay in the hospital, which is really the greatest news, at least for on the VA side of the pandemic. And those numbers are pretty well reflected in other parts of the country, though, in other parts of the country, you have many, many more people sick. And so you have many, many more people who potentially need to be hospitalized. So there are parts of the country seeing, a lot more people in hospitals than maybe in July and earlier this year. But, we are seeing some good news on VA's side of things.